Testing hip abduction against gravity position. Patient will be sidelined. First thing I will have my patient do is perform full hip abduction to the best of your ability. So bring your foot towards the ceiling as close as you can, Rachel, and come on back down. I will classify that as a 3. Now, to test for a 4 or 5, I will stabilize at the hip and I will apply resistance just proximal to the knee as to not cross that joint. So come up halfway, Rachel, apply resistance. Now with this, these muscles are tough, so I'm gonna have to really bear down because she's young and strong. 3, 2, 1, come back down. Because she's able to do that, I will classify that as a 5, but it can also be a 4 depending on the level of resistance your patient gives you. Testing hip abduction, gravity eliminated position. Patient will be supine. First thing you'll have your patient do is perform hip abduction while in this position. So Rachel, move out your leg as far as you can go and then back again. Because she's able to do that, that would be a 2. If there is no movement, then I will palpate for the gluteus medius found here on the lateral aspect of the hip. If I feel this muscle firing, that is a 1, and if I do not feel it firing, that is a 0.